everyone. This is a recording for the week 3, therapeutic communication and interviewing. The learning objectives. So by the end of the session, you will describe the principles of therapeutic communication, demonstrate effective communication techniques through the role play, identify and apply nonverbal communication strategies, some of the common barriers, and reflect on personal emotional state and their impact of communication. So, what is considered active communication or good communication? We have to have listening, empathy, compassion, clarity, cultural humility, nonverbal awareness as well. We have the CNO that states nurses are comfortable by developing an effective nurse-client relationship. Therapeutic communication is one of 4 standard statements of the therapeutic nurse-client relationship. It is establishing, maintaining, and reestablishing termination of the nurse-client relationship. So if you think of coming into your patient's room, establishing that relationship introduction, maintaining it for the 12-hour shift, and re-establishing would be maybe you're coming back tomorrow for the next shift and you have the same patient, and then maybe the patient is leaving for as a discharge, or maybe you are leaving for your 5 days off. You'll be terminating that relationship with the client. In the new role as a nursing student and a future role as a registered nurse, you must be aware of the CNO indicators of therapeutic communication and understand the role meeting the standards of the therapeutic nurse relationship. There's a hyperlink in here to the document. So for example, the indicators specifically how to introduce yourself, how to refer to a client, how to communicate with a client, and you are legally obligated to participate in the accountability of the standards that are set by the CNO. The next document is the best practice guidelines from the RNAO establishing a therapeutic relationship. The document is accessible through this link at the top, but it is really focuses on the maintaining professional boundaries to facilitate the trusting and therapeutic relationship between the nurse and the client. You must understand the professional role and to ensure that you are participating in the client-nurse relationship. Meeting the client outcomes is important, and of course, staying within your professional role and not to, for example, exchange phone numbers or accounts such as Instagram or Facebook, disclosure on personal information, or accepting or exchanging gifts as well. So when you are interviewing, consider that environment that you are with your patient. So make sure that it's a quiet location, it's welcoming to the environment where the patient is, in an exclusive space, opportunity to care for partners, maintain professional boundaries as well. And providing that maybe privacy, confidentiality. So if you think of a room that is shared with others, closing the curtain is not considered really confidential, right? So if you're sharing certain information, keep that in mind. When you are taking care of your patient, you are part of a team, and that's called circle of care that you have, and you are following the Personal Health Information Protection Act, which states that the client has the right to their professional information, your personal information to keep private. The healthcare professionals are legally required to keep the information confidential as well, and only involved the client's healthcare team for that specific person, right? So it's not to share information with others for no specific reason. The new term, care partners, this is where interviewing of a client, you must ask for individual if a care partner can stay beside them, right? So I ask the actual client if they would like to have a partner or the person to stay with you for the interview. right? So think of you, how many times you've been at maybe a medical office with someone, and the person asks you, would you like to have this person to stay with you, or do you want to talk to me by yourself, right? So asking for that consent. So client interview, the primary source would be considered getting the information from the patient themselves. The secondary source would be getting maybe the information from family, friends, caregivers, and other healthcare professionals. Really understand, what is the crucial identity of the purpose for that encounter, for that interview. Here are some tips for communicating with your patient. So use their first name, maybe preferred pronouns that they like. Always introduce yourself. Focus on the patient and avoid distractions. Always speak to the person at the age-appropriate manner. Speak clearly, slowly, and explain what you are doing. Use small words and simple sentences, and ask one question at a time and wait for that answer from that patient. Use eye contact and respect physical space, right? And think of yourself as well. Where are you with the patient? So if they're in bed and you're standing over them and you're interviewing them, you have power over them versus maybe grabbing a seat, a chair, and being at their eye level. So think of that. So here's a sentence for you, and I'm going to read it in multiple different ways. So really this exercise is for you to think about the tone and where you emphasize your words. So same sentence that just read a little bit differently. So the first one is, I never said she stole my money. So this would indicate someone else's might have said it, but not me. Next one. I never said she stole my money. This is absolutely did not say it. Okay, next one. I never said she stole my money. Maybe they implied it, but I didn't say it outright. Next would be, I never said she stole my money. So someone else's might have stolen it, but not her. Next. I never said she stole my money. Maybe she borrowed it, but didn't steal it. And the last one, two last ones is, I never said she stole my money. She might have stolen someone else's money, but not mine. And the last one, I never said she stole my money. She might have taken something else, but not the money. So you can see, same sentence, read just a little bit differently, spoken differently with the different tones and emphasis on the words. So think about that for a little bit. So, introduction to effective interviewing. We use this acronym here, would be sit at the angle of the patient, uncross your arms and legs, relax, eye contact, touch, and your intuition. Okay, so keep those things in mind. So physical touch, sometimes it is a therapeutic touch, but you have to really balance that, right? Some patients might not want to be touched or refuse to have that touch, and some patients or clients might actually really benefit from it. So active listening skills, there are multiple different things that are listed here. I want you to have a look at. So broad opening remarks, open-ended questions. Here's an example. Tell me more about your experience with, and it gives you that open-ended question, right? Sharing observations, clarification, validation, reflection. So reflecting on a question back to the patient. What are your thoughts? This seems really important to you. And offering yourself. I will be here for you. Would that help? Active listening, so restating to confirm understanding. Thank you for sharing. I want to make sure that I have all the right, whatever that is. Correcting and misconceptions, eye contact, silence, therapeutic touch, which I talked about, and summarizing. So it sounds like to me and then you say it. Active listenings, so using the word I and redirect it. If someone shows you the signs of being overly aggressive, agitated, or angry, this is the time to shift the discussion to another topic. So for example, I can see this topic fuels emotions, so I'd like us to come back to this later and move on to whatever the topic might be right now. Here is film clip 2.4 right in your textbook, how to avoid that giving false reassurance. So please make sure that you review that. Self-reflection is the importance of tool recognizing the emotional state and minimizing unintentional miscommunication with a client. That's non-therapeutic communication. And really it's examining your own cultures and how it affects the way you communicate with others. Here's a video that I'm not going to play here, but I want you to have a look at on your own. Don't want to take up this space here for that, but please review it in your PowerPoints. Cultural considerations. So this is culture indicating a person's ethnicity, spirituality, religion, therefore the person's practices on their own way. Culture is deeply embedded in everything that we do, absolutely everything that we do. So from the engineer's perspective, culture is not merely the sum of personal individual characteristics. It is emergent property of individual interacting with the nature and the human environment. So as a result, it's not static. Patient interviewing. So let's look at what that looks like. You've got motivational interviewing. You've got open-ended questions, affirming, reflective listening, and summarizing. Here's another video that once again I'm not going to play here, but please make sure you review that on your own. Let's move forward. If we were in a class, we would do role-playing interview skills. There's 3 scenarios. They are posted in Canvas if you want to have a look at that and reflect that on your own. And here is another video of motivating interviewing, a brief consultation. And the reflection, so the team steps using the I statements. So I, what you see, what you feel, what you need. So for example, I am concerned that the patient medication hasn't been administered yet. I feel unease because this could delay his recovery. I need us to clarify the schedule to ensure that it's given promptly. Here's another video that I'll let you watch on your own. Sorry, going back to here. So here's some barriers for communication. So poor listening skills, language difficulty, sensory impairment, hearing and vision, for example, emotional distress or mental issues, environmental noise and distraction. So keep those in mind. So close-ended questions would be yes or no questions. The why questions, why are you so angry? It's creates that barrier for communication. The bias, you seem a little withdrawn today, and changing the subject. Let's talk about something else, the judgment. So smoking is terrible for you. You should quit, right? The judgmental, you're judging somebody for smoking. And checks a box. So any more questions? Okay, no, see you later, right? Second that. So we would have done that activity. So let's just wrap up. The key takeaway from today's lesson, week 3, is therapeutic communication is a foundation of nurse-client relationship. Therapeutic communication is one of 4 standards: establishing, maintaining, re-establishing, termination, the nurse-client relationship as per the CNO. Privacy and confidentiality are important components of the client interview, and consider the client's interview thoroughly and use combination of communication strategies that was discussed in this session. Next week is online. The focus will be communication of ideas, ownership of ideas, and academic integrity. And you have to do spotlight number 2 right here. Professional Communication in Digital Era are PAI and Campus. Just a note for the spotlight number 1, when you're getting your badge, make sure that you have indicated on the screenshot that you're submitting into Canvas that has your name. If your name is not on there, if you don't get a certificate or some kind of a indication that you did the course, you will get incomplete until you submit a document that has your name on it and when you completed the spotlight. So make sure that you get the badge or some kind of a certificate, or you completed the modules and that it has your name on it. Thank you so much. That is all. And here are the references. Have a good day. Bye-bye.